KIMS is a 300-bedded multi-specialty hospital. We have, that means Krishna Institute of Medical Sciences has everything, that is skin and cardiac cases, neurology, renal, kidney transplants, brain surgeries, cosmetic surgery, pulmonology, gynecology, and we have the latest technology that is available in the world. That means we have a 3 Tesla MRI and we have 128 slice CT scan and a digital mammography, and we have 3 linear accelerators including the Novalis TX and a 40 slice PET scan which can detect 0.4 millimeter size malignant lesions, and also we can treat without damaging the normal tissue, both lungs, liver, where the movable organs also can be treated without damaging the neighboring tissue with a Novalis TX. And we also recently acquired the robotic surgery, which is the main, very precisely can perform the surgery. We have done more than 60 surgeries last 6 months through robotic assisted, and all the patients are doing very well. And we have done kidney transplants, we have done nearly 100 heart surgeries, about 100 angioplasties, about 400 angiograms every month. You name any department, we have everything, like rehabilitation, and we have a wellness clinic, and we will take care of the prevention, and then we will give the awareness about health and as well as disease. We all know that most of the things nowadays is related to the food, the higher society, urbanization. So, we need to control that. We have all these precautions and preventive measures. Any patient that comes to the hospital will also not only treat the disease, and also we encourage how they are going to go for a secondary prevention. The secondary prevention is nothing but, see, most of the diseases, if you look into that, these are all acquired. 70% of the diseases are acquired. Only 30% of the diseases come from genetics, that is from our forefathers. The 70% of the diseases what we are acquired is due to either food habits or the bad habits like alcohol, cigarette smoking, tension, blood pressure, sugar, and unhealthy foods which we take. So, we will also, if you take care of all these things, lack of exercise, walking and all, most of the diseases will not occur. But once the patient has come to the hospital, means that he has not followed all these precautionary measures, that is primary prevention. So, we also teach them the secondary prevention. That means make sure that any person who come for a disease, that means he will never get a disease again. That is not the correct thing. That is the reason we will try and teach them how to prevent further diseases once he enters into the hospital. That is the main important thing. The most important thing of Krishna Institute of Medical Sciences is that we have more than 100 consultants or full-timers. 90% of our consultants stay in this hospital, they will never able to practice any other hospitals other than this. Only 10% where they do not require to stay in the hospital, they will come like skin and other things. The advantage of all the consultants to stay in the hospital is you provide an emergency care. We have a specific emergency area. Once the patient comes, we will do all the investigations including CT scan, X-ray, ultrasound, so that a patient need not move around. That is the time where every minute counts. There are patients who have died lack of 5 minutes time. So, to safeguard this, we created everything in the emergency area including the operation theatre. So, what happened when all the specialists are available, like suppose a major trauma that occurs, it has to involve so many specialists, like for example, you have a general surgeon, you should be the neurosurgeon, an orthopedic surgeon, a thoracic surgeon, and when all these 4 are there at a time, if you diagnose in 5 minutes time, next half an hour the treatment will be done, then his quality of life will be much more if it is not delayed the emergency time. For example, if you have a heart attack, if it comes within 20 minutes, then if you do a primary angioplasty, the patient go home without any problems, and also his long term life will be very good. That means the myocardial damage will not occur. Same thing if you say a paralysis, paralysis means he is crippled for the entire life, his social life, his quality of life. If a person has a stroke, cerebral stroke, if he reaches within half an hour with the paralysis, if he comes, and then we have sent so many patients walking. That means we do a cerebral angiogram and give a drug where it can dilute the cerebral stroke and the paralysis will be recovered. So, these are all the utmost emergency areas where all these 90% of the full time consultant will help the quality and the emergency time, precious time for the patient. And this is the one. Then now if you look into in India, there are a few things are lacking. The lacking things is, one is the palliative care, another is the geriatric care. You know that because of the health, we are living a longer life. Our life is prolonged. When we prolong the life, then the advanced age, there is a set of diseases that comes, and to take care of them is very, very difficult, even difficult than the neonates. So, these are all called the geriatric age group. For them, we are setting up a big geriatric ward, at least 100 beds. Apart from that, there is another care where the palliative care. You know that there is patient is a terminal area. At that juncture, if you want to keep the patients, as on today everybody is keeping in the hospital, it costs a hell of money. Each day they spend 10 to 15,000 rupees, knowing that the patient may not recover. So, if we provide a palliative care, the cost will come down drastically. Not only the cost will come down, the quality also will improve. Once we have talked to the patients, patient attenders, you know this is a disease where it is not curable or you are not going to live longer, then we should give all variety of quality life for him. That is called palliative care. So, the palliative care and geriatric care. And apart from that, there is one more which is lacking in India at the moment, is the rehabilitation. You take a neuro rehabilitation, you take a ortho rehabilitation, you take a cardiac rehabilitation, whether it is a myocardial infarction or a post angioplasty or post bypass surgery or a major trauma that occurs. During that time, it is not only the disease what is cured. After that, you need to keep the patient rehabilitated. That means you should come back to the mainstream, enjoy his life, his quality of life. That is called rehabilitation. Those also we are going to create and put it in the KIMS. We are shortly going to open all these things in a better care.